So the study that we're presenting at ASCO this year is called MAGENTA, and that stands for Making Genetic Testing More Accessible. And so genetic testing has been around clinically for several decades, but we know that the uptake in individuals who have family histories, who have certain types of cancers, who are really recommended to undergo genetic testing based on national guidelines, that only about 20% of those individuals actually have genetic testing. So there's multiple reasons for that, but one is certainly accessibility. So the current way that a patient would get tested is by going to see a genetic counselor and having pre-test genetic counseling, and then perhaps deciding that they want it, and then going again to get their blood drawn. And then to get their results, they'd go back a third time to get their results with post-test genetic counseling. So that's been the traditional model. We know now through good randomized studies that doing that by phone, the pre-test and the post-test counseling, is equivalent to in-person. So that certainly increases the potential accessibility. We wanted to go one step further and to say, the majority of individuals who will test negative. And so the question is, can you set up an online platform that has safety built in so that if you test positive, we require, because it's good practice, to have genetic testing on the back end. But what about if we really had a online educational video? You could do it at home through a spit kit, and you could get your results if it was negative, just getting online information. And so essentially that was the study. And we enrolled over 3,000 women. We had two different cohorts. We had one cohort that was based on family history of breast or ovarian cancer. And all of the women in our study did not have cancer. So this isn't women who have breast cancer or have ovarian cancer. These are women who had no history of cancer. And then we had a second cohort that was women who had in their family a known mutation. So maybe they had a cousin that lived across the country who had called and said, I have a BRCA1 mutation and I wanted to let you know. And what we found is that, and surprisingly I would say, is that we did not really see a difference between any of the groups. So there were 4 groups. One was our standard of care group that got pre and post-test phone counseling. We had 2 other groups. One got pre-test phone counseling, but not post-test. The other one did not get pre-test, but did get post-test. And then the final arm was just everything electronic. Now, all women at all times had access if they wanted to talk to a genetic counselor. And then again, if they tested positive, they would speak to a counselor for results. But in the end, we did not find that the newer strategies of online electronic relay of information was inferior to standard of care. So the 3 groups that were a little bit different from the standard of care, none of them were inferior to what we consider standard of care. And we our primary outcome was looking at distress at 3 months. We also looked at regret associated with genetic testing, anxiety, things like that, and really did not see a difference between any of the groups.